At this year's ASH meeting, we are presenting data from over 800 patients who received standard of care ide-cel and who have been captured in the CIBMTR registry. The median follow-up of these heavily pretreated patients is about 12 months. And what we saw was very encouraging. The baseline characteristics of these patients are as expected for a very heavily pretreated population, with a median of actually 7 prior lines of therapy, even more than what was seen in the clinical trial with ide-cel, which was a median of 6 prior lines of therapy. A substantial proportion of these patients had high-risk cytogenetics, and over 75% of patients had significant clinical comorbidities, many of which would have made them ineligible for the KarMMa clinical trial. In this context, we saw that the safety and effectiveness of ide-cel was still very comparable to what we saw in the clinical trial. In terms of effectiveness, a response rate of 73% was observed, with a quarter of patients achieving a complete response. The median progression-free survival was 9 months, which is virtually identical to what we saw on the KarMMa clinical trial and in the multi-center US Myeloma Immunotherapy Consortium data that we recently published. When we look at safety, the incidence of cytokine release syndrome and neurotoxicity were very similar to the trial, in that most patients did develop cytokine release syndrome, and it was mostly grade 1 and 2. And ICANS was seen in about 20% of patients, again, mostly grade 1 and 2. A proportion of patients did have longer-term cytopenias beyond 1 month, and this is something we have to be very careful about and continue to follow up these patients for rigorous supportive care.